Hey everyone, welcome to another deep dive. Today we're going to be talking about the pelvis.
Okay.
And we're really going deep on this one. We have this anatomical PDF that goes into a ton of detail about the pelvis.
Wow.
And I was looking through it and I was like, wow, I did not realize how much was going on in there. So I've brought an expert here to
What?
help break it all down for us and to also tell us why this matters. Why should we care about the pelvis other than the obvious reasons?
Great. Yeah, I'm excited to talk about the pelvis. I think it's a really fascinating area.
Yeah, so to get started, I guess the pelvis is obviously very important for walking and standing and things like that, but what what else makes it so special?
Yeah, so I mean, it's really a powerhouse when it comes to your body. It transfers the weight of your upper body to your legs. It protects a bunch of really important organs like your bladder and reproductive organs. And it provides attachment points for muscles, and it also plays a really important role in childbirth. So it's a really crucial structure.
Yeah, the whole childbirth thing is very interesting to me because I know that those hip bones, we think of them as this solid structure, but they don't actually start out that way, do they?
Right, yeah. So each hip bone is actually made up of three separate bones, the ilium, the ischium, and the pubis, and they don't actually fuse together until you're between 20 and 25 years old.
Wow. So all through my teenage years, my hip bones were still kind of doing their own thing.
Exactly. Yeah, it's pretty amazing.
That's wild. I'm surprised they stayed together at all during all those like growth spurts and awkward phases and everything.
Yeah, it's a pretty amazing process, that fusion process, and it's really crucial for the pelvis to reach its full strength and stability so that it can do all of those important things that we talked about.
So it's kind of like building a bridge. You
Yeah.
need all those separate pieces to come together to make a really strong structure.
Exactly.
That makes sense. Okay, so let's talk about the overall structure of the pelvis, the pelvic girdle, I think it's called.
hmm
What are all the key players that we need to know about here?
Okay, so the pelvic girdle is made up of four bones. You have the two hip bones that we just talked about. And then you also have the sacrum, which is that triangular shaped bone at the base of the spine. And then you have the coccipitapex, which is also known as the tailbone.
Okay, so those are the four main bones, and are they all connected like a puzzle, or how does that work?
Yeah, they're connected by four joints, the two sacroiliac joints where the sacrum meets the hip bones on either side,
Yeah.
the pubic symphysis, which is the joint between the two pubic bones at the front, and the sacrococcygeal joint, which is where the sacrum meets the coccipitapex.
That's amazing how it all fits together so perfectly. I remember back in anatomy class learning about the acetabulum. Is that how you say it?
Yeah,
The acetabulum, and that's that socket where your femur or your thigh bone connects to your hip bone.
exactly. Yeah, and the acetabulum is actually formed by all three parts of the hip bone. The ilium, ischium, and pubis all coming together to form that socket.
Wow, so it's kind of like that perfect ball and socket joint where the head of the femur fits into the acetabulum.
Exactly. Yeah, it allows for a really wide range of motion.
So we've got this strong and flexible structure, and then here's where things get interesting to me, at least. The pelvis isn't just one big open space. It's actually divided into two parts,
Right.
the greater pelvis and the lesser pelvis. What is the difference between those two?
Yeah, so the greater pelvis is the upper portion of the pelvic cavity. It's basically an extension of the abdominal cavity, and it helps support the lower abdominal organs.
Okay, and then the lesser pelvis is below that.
Exactly. Yeah, it's below that pelvic brim, which is that bony ridge that separates the two regions. And the lesser pelvis is really important for childbirth because it forms the bony passageway that a baby has to pass through during delivery.
So it's kind of like the greater pelvis is like a waiting room, and then the baby moves down into the lesser pelvis for the main event.
That's a great way to think about it, yeah.
Okay. And the shape of the lesser pelvis is important for that whole process too, right?
Yeah, it is. It has a shallow anterior wall and a much deeper posterior wall. So it's kind of a curved path that the baby has to navigate.
It's amazing how the body is designed to accommodate such a dramatic event.
Mm-hmm.
So within that lesser pelvis, there's the pelvic cavity itself. And wow, there's a lot going on in there. It's like Grand Central Station.
It is a busy place. The pelvic cavity houses the terminal parts of the ureters, which carry urine from the kidneys to the bladder, the urinary bladder itself, the rectum, and the pelvic genital organs, which are the uterus and ovaries in females. And then it also contains parts of the abdominal viscera, like loops of the small intestine and portions of the large intestine.
It's like a delicate balancing act with all those organs packed into that space, what keeps everything in its place and protected.
Yeah, so the walls and the floor of the pelvic cavity are formed by a combination of bones, ligaments, and muscles. So it's like a multi-layered fortress that's keeping everything safe and sound.
Okay, so how many walls are there? I'm picturing like an actual fortress. Are there four walls?
Yeah, you can think of it as four walls, an antero-inferior wall at the front 2 lateral walls on the sides, and a posterior wall at the back. And then, of course, you have the pelvic floor as well.
Okay, so if we're picturing these walls, what are they made of specifically?
So the anteroinferior wall, which is at the front, is mainly formed by the pubic bones and the pubic symphysis.
Yeah.
You also have the obturator internus muscle there, which helps rotate the hip.
Mm-hmm.
And then the lateral walls are primarily formed by the obturator internus muscle and the obturator membrane, which is a strong sheet of connective tissue. And then the posterior wall is formed by the sacrum and the ilium and the piriformis muscle. And then the pelvic floor, which is like the base of this fortress, is a complex structure, but we'll get to that a little bit later.
Okay, so we've got these walls surrounding the pelvic cavity. And that brings us to the pelvic floor, which sounds like a very important structure.
Yeah, it's not just a passive floor. It's actually a dynamic structure that helps support the pelvic organs and separates the pelvic cavity from the perineum, which is the area below.
Okay.
And the main player here is the pelvic diaphragm.
The pelvic diaphragm.
Yeah, it's a sheet of muscle that plays a really crucial role in supporting those pelvic organs.
Okay, so it's kind of like a hammock holding everything up.
Yeah, that's a good way to think about it.
Okay.
It's primarily made up of 2 muscles, the levator ani and the coccygeus muscles and their fascia, and they basically close off the pelvic outlet posteriorly, but they have to allow passage for the urethra, the vagina, and the rectum. So it's kind of a tricky job.
So it's like a barrier, but also a gateway.
Exactly.
Okay, and then what about the levator ani? Is that actually a group of muscles?
You're right, it is, yeah. It's made up of 3 parts. The puborectalis, the pubococcygeus, and the iliacoccygeus.
Okay.
And they all work together to support the pelvic. Viscera resist increases in abdominal pressure and control urination bowel movements, and they even help support the uterus.
I've heard that the pelvic floor can be weakened during childbirth. Is that because of all the strain that's put on those muscles?
Yeah, unfortunately, during childbirth, the pelvic floor can be injured because of the stretching and the pressure from the baby's head.
Okay.
This can lead to issues like urinary stress incontinence, which is when you leak urine when you cough, sneeze, or exert yourself. Oh, wow.
It can also lead to other problems like fecal incontinence or even prolapse of the pelvic organs.
So it's important to do those Kegel exercises?
It is, yeah. Kegel exercises can help strengthen the pelvic floor muscles and prevent these problems.
Okay, good to know. So let's switch gears a little bit and talk about types of pelvises, because I know that not all pelvises are created equal. What are the main variations?
Right. So there are 4 main types of pelvises based on the shape and size of the pelvic inlet.
Okay.
You have the gynecoid pelvis, the android pelvis, the anthropoid pelvis, and the platypelvic pelvis. It's kind of like a pelvic fashion show.
Okay, I'm intrigued. Let's break these down. What is the gynecoid pelvis?
So the gynecoid pelvis is considered the typical female pelvis, and it's found in about 50% of women. It has a rounded inlet and a wide subpubic arch, which is the angle beneath the pubic bone.
Okay.
And this shape is considered ideal for childbirth because it offers the most spacious pathway for the baby to pass through.
Okay, fingers crossed, that's the one I have.
Right.
What about the android pelvis? Is that the male pelvis? It's more common in males, yeah, but some women do have an android pelvis as well.
Yeah.
It has a heart-shaped inlet and a narrower subpubic arch, and so it can make childbirth a little bit more challenging. But many women with android pelvis still have vaginal deliveries without any problems.
So it's not necessarily a deal breaker for vaginal birth.
Right, exactly.
Okay, and what about those other 2, the anthropoid and the platypelvic? They sound very interesting.
So the anthropoid pelvis has a long, narrow oval shape, and it's actually well suited for delivering babies who are in a posterior position, meaning that they're facing the mother's front.
Oh, okay.
And then the platypelvic pelvis is flat and wide, and it can make labor and delivery a little bit more challenging, but luckily it's the least common type.
Okay, so let's talk about those pelvic diameters, or I know the technical term is conjugates. They sound very important when it comes to childbirth. What are they?
Yeah, so the pelvic diameters or conjugates are basically measurements of the different parts of the pelvis, and they help determine how much space is available for a baby to pass through during labor and delivery.
Okay, so which one is the real MVP when it comes to childbirth?
So there are 4 key diameters that we measure: the anteroposterior diameter, the transverse diameter, the oblique diameter, and the interspinous distance.
Okay, can you break those down a little bit for me?
Yeah, so the anteroposterior diameter is the measurement from the sacral promontory, which is the top of the sacrum, to the upper margin of the pubic symphysis. And then the transverse diameter is the widest distance between the 2 sides of the pelvic inlet. And then the oblique diameter is the distance between the sacroiliac joint on one side and the iliopectineal eminence on the other side. And then the interspinous distance is the distance between the two ischial spines, which are those bony projections that you can feel inside your pelvis.
Okay, so which one is the most important for childbirth?
Probably the interspinous distance. It's usually the narrowest part of the pelvic canal, so that's the one that doctors are often most concerned about.
Okay, so it's like the narrowest passageway that the baby has to squeeze through.
Exactly.
Yeah.
But the good news is that the ligaments in this area can relax during pregnancy thanks to hormones like relaxin, so there is a little bit of flexibility there.
So the pelvic bones can actually shift a little bit to make room for the baby.
Yeah, pretty amazing.
That's incredible.
Yeah.
So let's talk about blood supply. Now, I imagine the pelvis needs a good blood supply, especially during pregnancy. What's the main artery that supplies this whole area?
Yeah, so the main artery is called the internal iliac artery, and it branches off of the common iliac artery.
Okay.
And it provides blood to all the pelvic organs, muscles, and bones.
So it doesn't just stop there, it branches out into all sorts of smaller arteries.
Exactly. Yeah, it has anterior and posterior divisions, and each division has a bunch of branches that supply different areas of the pelvis.
Okay, so it's like a highway system with all these different roads leading to different destinations.
Exactly.
And then where there are arteries, there are veins too, right?
Yeah, of course. So the internal iliac veins drain the blood from the pelvic walls and cavity, and they return it back to the heart.
What about the lymphatic system? I know it's responsible for filtering waste and fighting infection. Are there lymph nodes in the pelvis too?
Yeah, there are 4 main groups of lymph nodes in the pelvis: the external iliac nodes, the internal iliac nodes, the sacral nodes, and the common iliac nodes. And they all drain lymph from different areas of the pelvis and the lower limbs.
So it's like a series of checkpoints, making sure everything is clean and healthy.
Exactly.
Now, I'm curious about the nerves in this region. It must be a hotbed of nerve activity down there. What are the major nerves that we need to know about?
So the main nerve network is the sacral plexus.
The sacral plexus.
Yeah, it's formed by branches from spinal nerves L4, L5, S1, S2, S3, and S4. And it supplies nerves to the pelvic muscles, the muscles of the posterior thigh and leg, and the skin of the buttock and thigh.
Wow, that's a big job.
It is. Yeah, and it also gives rise to 2 very important nerves, the pudendal nerve and the sciatic nerve.
The sciatic nerve, isn't that the one that people have problems with?
Yeah, the sciatic nerve is the longest and widest nerve in the body, and it can be affected by a herniated disc or piriformis syndrome, which can cause pain, numbness, and tingling down the leg.
Ouch.
Yeah, it's not fun.
Okay, so what about the pudendal nerve?
So the pudendal nerve is important for sensation in the perineum and the external genitalia, and it also controls the muscles in those areas.
Okay, so it's all about feeling and function down there.
Exactly.
So let's move on to the pelvic viscera, those internal organs that call the pelvic cavity home. How is everything arranged in there?
So the arrangement of the organs varies a little bit between males and females, but in general, the bladder is at the front, followed by the reproductive organs, and then the rectum at the back.
Okay.
And in males, the prostate gland is located between the bladder and the rectum.
Okay.
And it's important to note that not all of these organs are completely covered by peritoneum. The peritoneum is that membrane that lines the abdominal cavity, and it does extend down into the pelvis, but it only covers the upper parts of some of the pelvic organs.
Okay, so some of them are kind of hanging out down there without that peritoneal covering.
Exactly.
Okay, so let's start with the urinary bladder. It's a very important organ. I know that much.
It is, yeah. It's basically a muscular sac that stores urine until you're ready to pee, and it can change its shape and position depending on how full it is.
Okay,
Yep.
I've always wondered this. Why do I need to pee more frequently as I get older? Is it because my bladder is shrinking?
It's not really that your bladder shrinks, but its capacity might decrease slightly with age, and the muscles of the bladder might not be as strong, so it might not empty as completely. And hormonal changes can also play a role. Like in women, after menopause, they often experience more frequent urination due to lower estrogen levels.
Okay, that makes sense. So it's not just about the size of the bladder, but also how well it functions.
Exactly.
So when the bladder is empty, what does it look like?
So when it's empty, it's kind of pyramidal shaped with 4 surfaces, a superior surface, which is on top, 2 inferolateral surfaces, which are on the sides, and a posterior surface, or fundus. And its position varies a little bit between males and females.
Okay. How?
So in males, it's directly in front of the rectum, and in females, it's in front of the vagina and the uterus.
Okay, so it's kind of sandwiched between those structures.
Yeah, exactly.
So how much urine can a typical bladder hold?
So a moderately full bladder can hold around 500 milliliters of urine, but it can stretch to hold up to a liter if necessary.
Wow, that's impressive. It's like a built-in reservoir.
It is.
So let's talk about what's going on inside the bladder. How does it manage to store and release urine so efficiently?
So the interior of the bladder has openings for the two ureters, which are those tubes that bring urine down from the kidneys. And then it has an opening for the urethra, which is how the urine exits the body.
Okay.
And these openings are arranged in a triangular area called the trigone, which is at the base of the bladder.
Okay, so it's like a three-way intersection. Urine's coming in from the kidneys and going out through the urethra.
Exactly.
So what keeps the urine from leaking out all the time?
So at the bladder neck, which is where the urethra begins, there's a special muscle called the sphincter vesicae, and it acts like a valve, keeping the urethra closed until it's time to urinate. And then in men, the sphincter also helps prevent semen from flowing backward into the bladder during ejaculation.
That's a very important job.
It is, yeah.
So what about the bladder wall itself? I imagine it has to be pretty strong to be able to hold all that urine and then contract to expel it.
Yeah, it's made up of three layers, the
Mhm.
mucosa, the muscularis, and the adventitia.
Okay, what is the mucosa?
So the mucosa is the innermost layer, the one that's in direct contact with the urine, and it's lined with a special type of epithelium called transitional epithelium, which can stretch and recoil as the bladder fills and empties.
Wow, that's pretty cool. It's like a built-in liner that can expand and contract as needed.
Yeah, it is.
What about the muscularis? It sounds like it's the muscle layer.
It is, yeah. It's the muscle layer of the bladder, and it's made up primarily of smooth muscle, which means that we don't have conscious control over it. And the main muscle here is called the detrusor muscle.
The detrusor muscle.
Yeah, and it has three layers that run in different directions, and when it contracts, it squeezes the urine out of the bladder.
So it's like a woven tapestry of muscle all working together to expel the urine.
Yeah, it is.
And then lastly, we have the adventitia. What's that?
So the adventitia is the outermost layer of the bladder, and it's made up of fibrous connective tissue, and its job is to provide structural support and anchor the bladder to the surrounding tissues.
Okay, so it's like the bladder's outer coat.
Yeah, exactly.
So we've got this three-layered bladder
Yeah,
diligently doing its job, storing and expelling urine.
yeah,
And then the urine's journey doesn't end there, does it?
yeah.
It still needs to get out of the body.
Right, so that's where the urethra comes, and the urethra is the tube that extends from the bladder to the outside world, and its job is to carry urine out of the body, and in males, it also carries semen during ejaculation.
And of course, there are differences between the male and female urethra.
Yeah, there are some significant differences.
So what can you tell me about the male urethra first?
Okay, so the male urethra is longer than the female urethra. It's about 15 to 20 centimeters long, and it's divided into three sections: the prostatic urethra, the membranous urethra, and the spongy urethra or penile urethra.
Okay, so let's break down those sections. What's the prostatic urethra?
So the prostatic urethra is the first part of the urethra, and it passes through the prostate gland.
Okay.
It's about 3 centimeters long, and it's the widest part of the male urethra.
Okay, then what about the membranous urethra?
The membranous urethra is the shortest and narrowest part of the male urethra. It's only about 1 to 2 centimeters long, and it passes through the urogenital diaphragm, which is a muscular structure that helps control urination.
Okay, and then lastly, we have the penile urethra.
Right, so the penile urethra is also called the spongy urethra, and it's the longest part of the male urethra. It's about 15 centimeters long, and it runs through the corpus spongiosum, which is one of the erectile tissues of the penis.
Oh, okay.
And it opens to the outside at the external urethral orifice.
So that's quite a journey for the urine to take.
It is, yeah.
What about the female urethra?
So the female urethra is much shorter than the male urethra. It's only about 4 centimeters long.
Wow, that's a big difference.
Yeah, it's a straight tube that runs from the bladder to the external urethral orifice, which is located in the vestibule of the vagina.
So it's a much simpler pathway.
Yeah, it is.
So while the male and female urethras are quite different, they both serve the same purpose, which is to eliminate urine from the body.
Exactly.
Okay, so let's shift gears again and delve into the male reproductive system, starting with the internal organs.
Okay, so the male internal genital organs include the ductus deferens or vas deferens, the seminal vesicles, the ejaculatory ducts, the prostate gland, and the bulbourethral glands.
Okay, there's a lot to unpack there.
Yeah.
Let's start with the ductus deferens or vas deferens. I know that's the pathway that sperm take from the epididymis to the ejaculatory duct. Can you walk me through that journey?
Yeah, so the ductus deferens is a thick-walled muscular tube. It's about 45 centimeters long, and it starts at the tail of the epididymis.
And remind me what the epididymis is.
Yeah, so the epididymis is a coiled tube that's attached to the testes, and it stores and matures sperm.
Okay.
So the ductus deferens starts there, and it travels upward through the inguinal canal, which is that passageway in the abdominal wall.
Okay.
And it enters the abdominal cavity, and then it loops over the urinary bladder, and then it descends back down into the pelvis towards the prostate gland.
Wait, so it goes all the way up into the abdomen and then back down.
It does, yeah.
Why does it take such a roundabout route?
So that's actually a remnant of our developmental history because the testes actually develop in the abdomen and then descend into the scrotum before birth. So the ductus deferens follows that same path.
Oh, that's interesting. It's like a historical roadmap.
Yeah, you could think of it that way.
So then once it gets near the prostate, what happens?
So near the prostate, the ductus deferens joins with the duct of the seminal vesicle to form the ejaculatory duct.
Okay, so let's talk about the seminal vesicles. Now they produce seminal fluid, which is a crucial component of semen, right?
Yeah, that's right. The seminal vesicles are paired glands. They're located behind the bladder, and their secretion makes up about 60% of the total volume of semen.
Wow, that's a lot. I've always wondered what makes seminal fluid so important for sperm. What does it actually do?
So seminal fluid is a complex mixture, and it has a lot of important functions.
Oh.
First of all, it's alkaline, which means it helps neutralize the acidity of the vagina.
Okay, why is that important?
So sperm are very sensitive to pH changes, and the vagina is naturally acidic. So the seminal fluid helps protect the sperm from being damaged by the acidic environment.
Okay, so it's like creating a safe passage for the sperm.
Exactly.
What else does seminal fluid do?
So it also contains fructose, which is a type of sugar, and that provides energy for the sperm.
Oh, so it's like giving them a little energy boost for their journey.
Exactly. And it also contains prostaglandins, which are hormone-like substances, and they help stimulate contractions in the female reproductive tract, which can help move the sperm towards the egg.
So they have a built-in cheering squad.
You could say that.
What else is in seminal fluid?
And finally, it contains clotting proteins, which cause the semen to coagulate shortly after ejaculation.
And why is that important?
So coagulation helps to keep the sperm together, and it also helps to keep them in the vagina for a longer period of time, which can increase the chances of fertilization.
Okay, so it's like a carefully designed delivery system.
It is.
So we've got sperm traveling down, the ductus deferens and seminal fluid being produced by this seminal vesicles.
Yeah.
Where do these two key players meet up?
So they meet up in the ejaculatory ducts.
Okay.
The ejaculatory ducts are short tubes that are formed by the union of the ductus deferens and the duct of the seminal vesicle, and they pass through the prostate gland and open into the prostatic urethra.
Okay, so it's like the grand finale where everything comes together.
Exactly.
Now, speaking of the prostate, let's talk about this often discussed gland. I know that it surrounds the prostatic urethra, but what does it actually do? And why does it seem to cause so many problems, especially for older men?
Yeah, so the prostate is an important gland, both for its function and because of the problems it can cause. So it's a walnut-sized gland. It's located below the bladder, and it's composed of smooth muscle and glandular tissue. It's encased in a fibrous capsule, and it's surrounded by a prostatic sheath. And then it has numerous ducts, about 15 to 20 of them, that open into the posterior wall of the prostatic urethra.
So it's like a little factory with all these different outlets releasing its product into the urethra. What exactly is that product?
So the prostate produces a thin, milky fluid that's added to the seminal fluid during ejaculation. And this prostatic fluid makes up about 30% of the total volume of semen.
That's a significant contribution. What's in this prostatic fluid that makes it so important?
So the prostatic fluid is slightly acidic, and it contains citric acid, which is thought to help nourish the sperm. It also contains enzymes like prostate-specific antigen, or PSA, and acid phosphatase, which can help liquefy the semen after ejaculation.
Oh, interesting. So it's all about supporting and protecting the sperm.
Exactly.
And this all happens when the prostate contracts during ejaculation, pushing those prostatic secretions into the urethra.
That's right.
So we've got this carefully orchestrated process where each gland is contributing its unique component to this final product. But you mentioned that the prostate can cause problems, especially as men age. What's the deal with that?
So one common problem is benign prostatic hyperplasia, or BPH.
Benign prostatic hyperplasia.
Yeah, that's a mouthful. But basically what it means is that the prostate gland enlarges as men get older, and this enlargement can constrict the urethra, making it difficult to urinate.
So why does the prostate enlarge as men age?
So the exact cause of BPH is not fully understood, but it's thought to be related to hormonal changes that occur with aging as men get older. The balance of hormones like testosterone and dihydrotestosterone or DHT shifts, and this can stimulate prostate cell growth.
So are there any consequences to this enlargement other than just making it harder to pee?
Yeah, BPH can lead to all sorts of urinary problems like difficulty starting and stopping urination, a weak urine stream, a feeling of incomplete emptying of the bladder, and more frequent urination, especially at night.
So it can really impact a man's quality of life.
It can.
And is BPH cancerous?
No, BPH itself is not cancerous. It's a benign condition, but it's important to have it evaluated by a doctor because an enlarged prostate can sometimes be a sign of prostate cancer.
Okay, that's good to know. Now, what about those other glands, the bulbourethral glands?
Oh, yeah, the bulbourethral glands are also known as Cowper's glands, and they're pea-sized glands that are located on either side of the membranous urethra, and they secrete a clear, slippery fluid that helps to lubricate the urethra and neutralize any acidity that might be present from urine.
Okay, so they're like a pre-ejaculatory lubrication team.
You could think of it that way, yeah.
Now let's move on to the female internal genital organs. There's a lot going on there too.
Yeah, there is. So the female internal genital organs include the vagina, the uterus, the uterine tubes, and the ovaries.
Okay, let's start with the uterus, that incredible organ that's responsible for nurturing and housing a developing fetus. I know that it's pear-shaped. Can you tell me more about its size and its position in the body?
Yeah, so the uterus is located in the pelvic cavity between the bladder and the rectum, and it's about 7 to 8 centimeters long, 5 to 7 centimeters wide, and 3 centimeters thick in a woman who hasn't been pregnant. And of course, it expands significantly during pregnancy to accommodate a growing fetus.
It's amazing how much it can change, and I know it has different parts, right? The fundus, the body, and the cervix.
Yeah, that's right. The fundus is the rounded top portion of the uterus above where the uterine tubes enter the body, is the main central portion, and the cervix is the lower narrow portion that connects to the vagina.
And the cervix is pretty important, isn't it? It's like the gateway between the uterus and the vagina, and it produces mucus. I remember learning about that, but I'm not sure what the purpose of that mucus is.
Yeah, so the cervical mucus is actually really interesting. It plays a couple of different roles. It helps to protect the uterus from bacteria that might try to enter from the vagina, and it also helps to regulate sperm entry into the uterus.
Okay, so how does it do that?
So for most of the menstrual cycle, the mucus is thick and sticky, which makes it difficult for sperm to penetrate. But around the time of ovulation, when an egg is released from the ovary, the mucus changes consistency. It becomes thinner and more watery, which allows sperm to pass through more easily.
So it's like the cervix knows when to open the door for this
It's
fun.
exactly, yeah, it's pretty amazing.
So what about the position of the uterus? I've heard it can be tilted forward or backward. Does that matter?
Yeah, so the uterus is usually tilted forward, which is called anteverted, and it's also bent forward over the cervix, which is called anteflexed. But in some women, the uterus is tilted backward, which is called retroverted.
Okay. Is one position better than the other?
No, not really. A retroverted uterus doesn't necessarily cause any problems. It's just a variation in anatomy.
Okay, so it's a pretty flexible organ, both literally and figuratively.
Yeah.
Now, how does uterus stay in place? What keeps it from moving around too much?
So the uterus is supported by a combination of ligaments and muscles. So the ligaments attach the uterus to the surrounding structures, and the muscles, particularly the levator ani muscles, help to keep it from descending too far down into the vagina.
Okay. And what happens if those muscles are weakened or damaged?
So if those muscles are weakened or damaged, the uterus can start to descend into the vagina, which is called uterine prolapse. And that can cause a lot of problems like discomfort, urinary incontinence, and difficulty with bowel movements.
Okay, so those pelvic floor exercises are important for more than just bladder control.
They are.
Now let's talk about the structure of the uterine wall itself. I know it has multiple layers. Can you break those down for me?
Yeah, so the uterine wall has 3 layers: the perimetrium, the myometrium, and the endometrium.
Okay, what's the
The
perimetrium?
perimetrium is the outermost layer, and it's basically just the visceral peritoneum that covers the uterus. And then the myometrium is the thickest layer of the uterine wall, and it's made up of smooth muscle. And this is the layer that contracts during labor to help expel the baby.
Wow, so it's the muscle that gives birth.
It is, yeah.
That's pretty amazing. And then lastly, we have the endometrium.
Right, so the endometrium is the innermost layer of the uterine wall, and this is the layer that's shed during menstruation.
Okay, but what is the endometrium like?
So it's a mucous membrane, and it's composed of simple columnar epithelium and a thick layer of connective tissue called the lamina propria, and is very vascular, which means it has a lot of blood vessels.
Okay, and this layer is very responsive to hormones, right?
It is, yeah. It undergoes changes throughout the menstrual cycle in response to estrogen and progesterone.
So can you tell me more about those changes?
Sure. So to understand the changes, it helps to know that the endometrium is actually made up of two layers, the stratum functionalis and the stratum basalis.
Okay, so we have two layers within a layer. What makes these two layers different?
So the stratum functionalis is the superficial layer, the one that's closest to the uterine cavity, and it's the layer that responds to hormonal changes during the menstrual cycle.
Okay.
So under the influence of estrogen, the stratum functionalis grows and thickens, and it becomes engorged with blood vessels getting ready for a potential pregnancy.
Okay, so it's like laying out the welcome mat for a fertilized egg.
Exactly. But if fertilization doesn't occur, then the stratum functionalis breaks down and is shed during menstruation, and that's what causes menstrual bleeding.
Oh, so it's the layer that's constantly changing throughout the cycle.
Right.
What about the stratum basalis?
So the stratum basalis is the deeper layer, and it's not shed during menstruation. It stays put, and it actually gives rise to a new stratum functionalis after menstruation, starting the cycle all over again.
So it's like the regenerative layer, the one that makes sure that the cycle can continue.
Yeah.
That's pretty amazing how the body just does this every month.
It's a really remarkable process, and it shows just how incredible the female body is in terms of its regenerative powers. But sometimes things can go wrong with this process, and that's when you get conditions like endometriosis.
Oh, yeah, endometriosis. I've heard of that. That's when
Yeah.
the tissue that's supposed to be in the uterus grows outside the uterus, right?
Exactly. Yeah. So in endometriosis, fragments of endometrial tissue are found in places where they shouldn't be, like the ovaries, the fallopian tubes, or even the lining of the pelvic cavity.
Okay.
And the problem is that this misplaced tissue still responds to hormones. So it still builds up and breaks down every month. But because it's not in the uterus, it can't be shed properly. And so this can cause inflammation, pain, and often infertility.
Oh, wow, that sounds really painful and frustrating.
It is, yeah. It's a really difficult condition for a lot of women.
So hopefully researchers will find better treatments for endometriosis soon. That sounds awful.
Yeah, I agree.
Okay, so back to the uterus.
Yeah.
How does it get its blood supply? I imagine it needs a lot of blood, especially during pregnancy.
Yeah, it does. So the main blood supply to the uterus comes from the uterine arteries.
Okay.
And these arteries branch off of the internal iliac arteries, which we talked about earlier.
Right.
And then they divide into smaller and smaller branches within the uterus, and eventually they reach the endometrium.
So it's like a complex network of blood vessels.
It is, yeah. And those blood vessels have to adapt to the changing needs of the uterus throughout the menstrual cycle and during pregnancy.
Okay, and then what about venous drainage? How does the blood get out of the uterus once it's delivered oxygen and nutrients?
So venous drainage is handled by the uterine veins, which follow a similar path as the arteries, but in reverse.
Okay, so they carry the deoxygenated blood back towards the heart.
Exactly.
So it's really an efficient system.
It is.
Okay, let's move on to the uterine tubes, also known as the fallopian tubes. They connect the ovaries to the uterus, right? And they're super important for fertilization.
They are, yeah. They're basically the conduits between the ovaries and the uterus, and they're where fertilization usually takes place.
So they're like the meeting place for sperm and egg.
Exactly, yeah. It's kind of romantic when you think about it.
It is. So what can you tell me about the different parts of the uterine tube?
Sure. So each uterine tube is about 10 to 12 centimeters long, and it has four main parts: the infundibulum, the ampulla, the isthmus, and the uterine part.
Okay, let's break those down. What's the infundibulum?
So the infundibulum is the funnel-shaped end of the uterine tube that's closest to the ovary, and it has these finger-like projections called fimbriae that drape over the ovary.
Okay, so it's like a catcher's mitt waiting to scoop up that egg.
Yeah, that's a good way to think about it.
Okay, and then once the egg is caught, what happens?
So once the egg is caught, it enters the ampulla, which is the widest and longest part of the uterine tube, and this is usually where fertilization takes place.
Okay, and if fertilization occurs, what happens next?
So if fertilization occurs, the fertilized egg, which is now called a zygote, continues its journey through the uterine tube, and it enters the isthmus, which is the narrowest part of the tube. And the isthmus connects the ampulla to the uterine part, which is the short segment of the tube that passes through the wall of the uterus.
Okay, so the uterine part is the final destination.
Exactly. Yeah, that's where the fertilized egg implants in the endometrium and begins to develop.
So what a journey.
It is a pretty amazing journey.
Okay, so what about the wall of the uterine tube itself? What is it made of?
So the wall of the uterine tube has three layers: the mucosa, the muscularis, and the serosa.
Okay, what's the mucosa?
The mucosa is the innermost layer, and it's lined with ciliated simple columnar epithelium.
Okay, and what do those cilia do?
So the cilia beat in a coordinated fashion, and they create a current that helps to move the egg or the fertilized egg towards the uterus.
Oh, so it's like a little conveyor belt.
Yeah, you could think of it that way.
And what about the muscularis?
So the muscularis is the middle layer, and it's made of smooth muscle, and these muscles contract rhythmically to create peristaltic waves, which also help to propel the egg towards the uterus.
So we've got these cilia creating a current, and these muscles creating waves, all working together to move that egg along.
It's amazing how it all works together, isn't it?
It is. It's like a team effort. And then lastly, we have the serosa.
Yeah, the serosa is the outermost layer, and it's just the visceral peritoneum that covers the uterine tube.
Okay, so it's just a continuation of that seroless membrane.
Right.
Now, I've heard of tubal ligation as a form of contraception. Can you explain what that is?
Yeah, so tubal ligation is a surgical procedure where the uterine tubes are blocked or cut, and this prevents sperm from reaching the egg and the egg from reaching the uterus. So it's a permanent form of sterilization for women.
Okay, so it's a very effective method of contraception, but it's permanent.
Right.
Okay, let's move on to the ovaries. Now, they are the female gonads. They produce eggs and hormones. Tell me more about their location and structure.
Okay, so the ovaries are almond-shaped glands. They're about 3 centimeters long.
Yeah.
And they're located on either side of the uterus, kind of hanging out there in the pelvic cavity.
Okay, and I've heard that the surface of an ovary can look kind of bumpy. Is that normal?
It is, yeah. The surface of a mature ovary is irregular with all these bumps and depressions, and that's because of the presence of ovarian follicles at different stages of development. You'll also see corpora lutea, which are structures that form after ovulation, and scars from previous ovulations.
So they kind of wear their history on their surface.
You could say that, yeah.
What keeps the ovaries in place?
So each ovary is held in place by ligaments. The ovarian ligament attaches the ovary to the uterus, the suspensory ligament attaches it to the pelvic wall, and the mesovarium, which is a fold of peritoneum, suspends it between the uterine tube and the uterus.
Okay, so they're pretty well secured in there, which makes sense given how important they are. What about the inside of an ovary? What does it look like under a microscope?
So the ovary has an outer layer of simple cuboidal epithelium called the germinal epithelium, and then beneath that is a tough fibrous capsule called the tunica albuginea, and then beneath that is the main substance of the ovary, which is divided into 2 regions, the cortex and the medulla.
Okay, so the cortex and the medulla, what's the difference?
So the cortex is the outer region, and it contains the ovarian follicles, and the medulla is the inner region, and it contains blood vessels and nerves and connective tissue.
So the cortex is where the action is with those developing follicles.
It is.
Tell me more about the follicles. How do they develop?
Okay, so ovarian follicles go through a really amazing journey. They start out as primordial follicles, which are present at birth, and then during puberty, a small number of primordial follicles start to develop each month, and they go through several stages of development. They become primary follicles, then secondary follicles, and finally mature follicles, which are also called Graafian follicles.
Okay, so what happens at each stage?
So as a follicle develops, the oocyte, which is the egg gets bigger and the surrounding follicular cells multiply. And as the follicle continues to grow, it develops the fluid-filled cavity called the antrum.
So it's like a little swimming pool forms inside the follicle.
Yeah, you could think of it that way. And then eventually the mature follicle bulges from the surface of the ovary and it's ready to release the egg during ovulation.
So what triggers ovulation?
So ovulation is triggered by a surge in luteinizing hormone, or LH, and this hormone surge causes the wall of the mature follicle to rupture, and that releases the egg into the pelvic cavity.
And then what happens to the ruptured follicle?
So it doesn't just disappear, it actually transforms into a corpus luteum.
Okay, a corpus luteum. What's that?
So the corpus luteum is a temporary endocrine gland that forms from the remnants of that ruptured follicle.
Okay.
And it starts producing progesterone and some estrogen, and these hormones are important for preparing the endometrium for implantation if a fertilized egg comes along.
So it's like the follicle gets a second life as a hormone factory.
Exactly.
And what happens to the corpus luteum if pregnancy doesn't occur?
If pregnancy doesn't occur, the corpus luteum degenerates after about 10 to 14 days, and hormone levels decline, and that triggers menstruation.
Okay, that makes sense. So now I'm curious about how the ovaries get their own blood supply. It seems like they would need a pretty good blood supply.
They do, yeah. So the ovaries get their blood supply from the ovarian arteries.
Okay, where do those come from?
So the ovarian arteries branch off of the abdominal aorta, and they travel a long distance to reach the ovaries.
So they have their own special highway for delivering oxygen and nutrients.
Exactly.
Okay, and then what about venous drainage?
So venous drainage is handled by the ovarian veins, and the right ovarian vein drains directly into the inferior vena cava, while the left ovarian vein drains into the left renal vein and then into the inferior vena cava.
Okay, so even the drainage pathways are different on the right and left sides of the body.
That's interesting.
Yeah, it is.
Okay, let's move on to the vagina. Now, I know it's involved in intercourse and childbirth, but what else does it do? So the vagina is a really amazing organ. It's a muscular tube. It's about 7 to 9 centimeters long, and it connects the cervix to the external genitalia, and it serves as a passageway for menstrual fluid. It's the lower part of the birth canal, and of course, it's the female organ of copulation.
So it's pretty versatile.
It is, yeah, and it has to be pretty strong to handle all of those different functions.
So what about the structure of the vagina? What's it made of?
So, like many of the structure we've talked about, the vagina has 3 layers: the mucosa, the muscularis, and the adventitia.
Okay, so starting with the mucosa, what is that like?
So the mucosa is the innermost layer, and it's lined with stratified squamous epithelium, which is a type of epithelium that's really good at withstanding friction.
That makes
Yeah.
sense given its function.
Yeah, it does.
That's interesting about the vaginal mucosa.
So one interesting thing is that it doesn't have any glands of its own.
Okay.
So the lubrication comes from the cervix and from the vestibular glands, which we'll talk about a little bit later.
Yeah. Okay, so it relies on its neighbors for lubrication. What else is interesting about the vaginal mucosa?
So the cells of the vaginal mucosa produce glycogen, and the bacteria that live in the vagina metabolize this glycogen to lactic acid, which makes the vaginal environment acidic.
Oh, okay. Why is that important?
So that acidity helps to protect the vagina from infection.
So it's a self-cleaning and self-protecting environment.
Exactly. Yeah, it's a really cool system.
And can things disrupt that system?
Yeah, they can. So things like douching or using antibiotics can actually disrupt the balance of bacteria in the vagina, and that can lead to infections.
Okay, so it's best to just let the vagina do its thing.
Exactly.
Okay, what about the muscularis?
So the muscularis is the middle layer of the vaginal wall, and it's made up of smooth muscle. And this allows the vagina to expand and contract, which is important for both intercourse and childbirth.
Okay, and lastly, we have the adventitia.
So the adventitia is the outer layer, and it's made up of fibrous and elastic connective tissue, and it basically provides structural support and anchors the vagina to the surrounding tissues.
Okay, so it holds everything together.
Exactly.
Now, I know we've all heard about the hymen, that thin membrane that's often associated with virginity, but I'm not really sure what it is or why it's there.
Yeah, so the hymen is a thin fold of mucous membrane that partially covers the vaginal opening in some women.
Okay.
And it's usually incomplete, which means it has an opening to allow for the passage of menstrual fluid.
Okay, so it's not a completely sealed membrane.
No, it's not, and it can vary a lot in shape and size from woman to woman, and it can also be stretched or torn during things like sexual intercourse, tampon insertion, or even strenuous exercise.
So the presence or absence of a hymen is not a reliable indicator of virginity.
Exactly. Yeah, there are a lot of misconceptions about the hymen.
That's an important point.
Yeah.
Okay, so I know that childbirth can sometimes lead to complications that affect the vagina. Can you tell me more about those?
Yeah, so a really prolonged or difficult labor can sometimes cause tears in the vaginal wall or even damage to the surrounding tissues. And these injuries can sometimes lead to the formation of fistulas. Yeah, fistulas are abnormal passages that can form between the vagina and the bladder or the rectum.
Oh, wow, that sounds serious.
It is, yeah, it can cause leakage of urine or feces into the vagina, which is obviously a big problem.
Yeah, that's awful.
But the good news is that these fistulas can often be repaired surgically.
Okay, so it's treatable.
It is.
Okay, now let's talk about the perineum, that area between the thighs that includes the external genitalia.
Okay, so the perineum is a diamond-shaped area that extends from the pubic symphysis to the caustugs, and it's bounded on the sides by the ischial tuberosities.
So basically, it's the floor of the pelvis.
Exactly, and it's divided into 2 triangles, the urogenital triangle, which is the front triangle, and the anal triangle, which is the back triangle.
Okay.
And the urogenital triangle contains the external genitalia, and the anal triangle contains the anal canal and the anus.
Okay, so the perineum is a very busy area.
It is, yeah.
So let's focus on the male external genitalia. Now, starting with the testes. I know we talked about their internal structure, but remind me about their location and why that location is so important.
Right, so the testes are located in the scrotum, which is that sac of skin that hangs outside the body behind the penis.
Okay.
And that external location is really important because it keeps the tests at a slightly lower temperature than body temperature, which is necessary for sperm production.
Okay, so it's all about temperature control.
It is.
But doesn't that external location make the testes more vulnerable to injury?
They are somewhat more vulnerable, but the scrotum does provide some protection. And the cremaster muscle, which is a muscle that's attached to the testes, can contract to pull the testes closer to the body for warmth or protection.
Oh, that's interesting. It's like they have their own little bodyguard.
Yeah, you could think of it that way.
So remind me about the structure of the testes. What are the key components?
So each testis is covered by a tough fibrous capsule called the tunica albuginea. And then on the posterior side of the testis, this capsule thickens to form the mediastinum testis. And from the mediastinum testis fibrous septa extend inward, dividing the testis into about 250 lobules.
So it's like the testes is divided up into all these little compartments. What's inside those compartments?
So inside the lobules, you have the seminiferous tubules, which are where sperm are produced.
Okay, so that's where the sperm factories are located.
Exactly.
What's in between those tubules?
So between the tubules, you have clusters of interstitial cells, also called Leydig cells, and these cells produce testosterone.
Okay, so the testes are responsible for both sperm production and testosterone production.
Yeah, that's right.
Very important functions. Okay, now let's talk about the blood supply to the testes. It seems like they would need a pretty good blood supply.
They do, yeah. So the testes receive their blood supply from the testicular arteries, which branch off of the abdominal aorta.
So that's a long way for the blood to travel.
It is, yeah. The arteries have to travel down through the inguinal canal to reach the testes.
And then what about venous drainage?
So venous drainage is handled by the testicular veins, and these veins form a network called the pampiniform plexus around the testicular artery.
Okay.
And this plexus is really cool because it acts as a heat exchanger. It cools the blood coming in from the artery before it reaches the testes.
So it's like a built-in air conditioner for the testes.
Exactly. It helps keep those sperm happy.
That's incredible. Now, what about cryptorchidism? I've heard of that condition where one or both tests don't descend into the scrotum.
Yeah, so cryptorchidism is a condition where one or both testes fail to descend from the abdomen into the scrotum during fetal development.
Okay.
And it's actually fairly common. It occurs in about 3 to 5% of full-term male infants.
Wow. And why is it important to correct that?
So it's important to correct it because if a testis remains undescended, it's at an increased risk of developing cancer, and it's also likely to be infertile because the temperature inside the body is too high for sperm production.
So it's important to get that fixed early on.
It is.
What about a hydrocele? What's that?
So a hydrocele is basically just a collection of fluid in the tunica vaginalis, which is that serous sac that surrounds the testes.
Okay.
It can be caused by inflammation or injury, or it can just happen for no apparent reason.
So it's like a fluid-filled sac around the testes.
Exactly.
Does it cause problems?
It can sometimes cause discomfort, or it can be cosmetically unappealing, but often it's just a harmless condition.
Okay. And is it treatable?
Yeah, if it's causing problems, it can usually be treated with a simple surgical procedure to drain the fluid.
Okay, so I know that attached to the posterior surface of each testes is the epididymis. Can you tell me more about that structure?
Yeah, so the epididymis is a long coiled tube that sits on top of the testes, and it's responsible for storing and maturing sperm.
Okay, so the sperm are produced in the testes, and then they travel to the epididymis to mature.
Yeah, the sperm spend about 10 to 14 days in the epididymis before they're ready to be ejaculated.
Wow, so it's like a finishing school for sperm.
You could think of it that way.
Okay, so how is the epididymis structured?
So it has 3 parts: the head, the body, and the tail. And the head is the part that receives sperm from the efferent ductules of the testes. And then the body is the main coiled portion, and that's where the sperm matures. And then the tail stores the mature sperm and connects to the ductus deferens.
Okay, so it's all very organized.
It is.
What about the scrotum, that pouch of skin that holds the testes? What's its role?
So the scrotum is more than just a container. It's a fibromuscular sac, and it has a really important role in regulating the temperature of the testes.
Okay, we talked about that earlier. How does it actually work?
So the scrotum has a layer of smooth muscle called the dartos muscle, and this muscle can contract to pull the testes closer to the body for warmth, or it can relax to allow the testes to hang further away from the body to cool down.
So it's like a built-in climate control system.
Exactly.
And then inside the scrotum, there's a septum that divides it into 2 compartments, one for each testes. Okay, so let's move on to the penis. Now, it's the male organ of copulation. What can you tell me about its structure and how it functions?
Okay, so the penis is composed of 3 cylindrical masses of erectile tissue, 2 corpora cavernosa and 1 corpus spongiosum. And the corpora cavernosa are located on the dorsal side of the penis, and the corpus spongiosum is located on the ventral side, and it surrounds the urethra.
Okay. And what is erectile tissue?
So erectile tissue is specialized tissue that contains lots of blood sinuses, and during sexual arousal, nerve impulses cause the arteries that supply the penis to dilate, and this allows blood to flow into the sinuses, and the sinuses become engorged with blood, which causes the penis to become erect.
Okay, so it's all about blood flow.
It is, yeah.
And the corpus spongiosum, which surrounds the urethra, it doesn't become as rigid as the corpora cavernosa, right?
That's right, yeah. It stays more pliable, and that's important because it protects the urethra from being compressed during an erection.
Okay, that makes sense. So can you tell me more about the different parts of the penis?
Yeah, so the penis is divided into 3 main parts: the root, the body, and the glans penis. The root is the proximal part, the part that attaches to the body, and the body is the main shaft, and the glans penis is the expanded distal end, or the tip.
Okay, and the glans penis is covered by the foreskin in uncircumcised men. Wait, what about impotence? What causes that?
So impotence or erectile dysfunction is the inability to achieve or maintain an erection that's firm enough for sexual intercourse.
Okay.
And it can be caused by lots of different things. It can be psychological, like stress or anxiety or relationship problems, or it can be physical, like vascular disease, neurological disorders, hormonal imbalances, or certain medications.
So it's a complex issue with a lot of potential causes.
Yeah, it is.
Okay, let's move on to the female external genitalia, now also known as the vulva.
Okay, so the vulva includes the mons pubis, the labia majora, the labia minora, the clitoris, the vestibule, the bulbs of the vestibule, and the vestibular glands.
Okay, that's a lot of structures.
Yeah, there's a lot going on down there.
So let's break it down, starting with the mons pubis. What is that?
So the mons pubis is that rounded fatty area that's located over the pubic symphysis.
Okay.
And after puberty, it's covered with pubic hair.
Okay, and then we have the labia majora.
So the labia majora are the 2 prominent folds of skin that extend downward and backward from the mons pubis.
Okay, and those are covered with pubic hair too.
Yeah, they are.
And then we have the labia minora.
So the labia minora are 2 smaller folds of skin that lie within the labia majora, and they're hairless.
Okay, and what do they do?
So they enclose the vestibule, which is the space that contains the openings of the urethra and the vagina.
Okay.
And they're also very sensitive to touch.
Okay, and then we have the clitoris.
Yes, the clitoris is a small erectile organ that's located at the anterior junction of the labia minora.
Okay.
And it's homologous to the penis in males, which means it develops from the same embryonic tissue.
Okay.
And it's very sensitive to touch as well.
Now, remind me about the vestibule. What's in there again?
So the vestibule is the space that's enclosed by the labia minora, and it contains the openings of the urethra, the vagina, and the ducts of the vestibular glands.
Okay, and what are the bulbs of the vestibule?
So the bulbs of the vestibule are paired masses of erectile tissue that lie beneath the labia minora on either side of the vaginal opening, and they become engorged with blood during sexual arousal.
Okay.
So they contribute to the overall swelling and sensitivity of the vulva.
And lastly, we have the vestibular glands.
Yeah, so the vestibular glands are responsible for producing mucus that lubricates the vagina during sexual arousal. And there are 2 types: the greater vestibular glands, which are also called Bartholin's glands, and the lesser vestibular glands.
Okay, and what's the difference between those 2?
So the greater vestibular glands are larger, and they're located on either side of the vaginal opening. And the lesser vestibular glands are smaller, and they're scattered throughout the vestibule.
Okay, so it's amazing how all of these different structures work together.
It really is.
We've covered a lot of ground today exploring the pelvis and all its complexity. And it's clear that the pelvis is a very important structure, both for men and women.
It is. Yeah.
So to our listener, we encourage you to learn more about your own body and appreciate all the amazing things that it does for you every day.
Absolutely. It's a delicate balance, isn't it? You have to have that stable structure for our bodies, but also create a pathway for, new life to enter the world.
Yeah, it makes you realize how interconnected everything is, like our bones, our muscles, our organs. It's all working together.
Yeah, a symphony of structure and function.
Exactly, and it's a symphony that plays out differently in males and females, reflecting the different roles that they play in reproduction. So speaking of those distinct roles, I think we should shift our focus back to the external genitalia and kind of wrap up our discussion of the male and female reproductive systems.
Sounds good.
So let's start by revisiting the male external genitalia. We already talked about the testes, hanging out in the scrotum, but there's more to the external anatomy than just that. front and center we have the penis. Can you just give us a quick recap of how it's structured and how it works?
Yeah, so the penis is the male organ of copulation.
Yeah.
It's cylindrical in shape, and it has those three parts: the root, the body, and the glans penis.
Right.
The root is the part that attaches to the body is the main shaft, and the glans penis is that expanded tip.
And the glans penis is very sensitive, right?
Yes, it is. It's richly supplied with sensory nerve endings, and in uncircumcised males, it's covered by the foreskin.
Right. Okay, so what about the internal structure? What makes it able to become erect?
So the key is erectile tissue.
Erectile tissue.
Yeah, and the penis has 3 cylinders of this erectile tissue, the 2 corpora cavernosa and the corpus spongiosum.
Okay.
So the corpora cavernosa are on the dorsal side of the penis, and the corpus spongiosum is ventral, and it surrounds the urethra.
Okay, so those erectile tissues are what fill with blood during an erection.
Exactly, yeah. So during sexual arousal, nerve impulses trigger the arteries that supply the penis to dilate, and this increases blood flow to the erectile tissue, and the spaces within the tissue fill with blood, causing it to become engorged and erect.
So it's a hydraulic system.
Yeah, you can think of it that way.
And the corpus spongiosum, which surrounds the urethra, that doesn't get as rigid as the corpora cavernosa, right?
That's right. Yeah, it stays more pliable. And that's important because it protects the urethra from being compressed.
So it allows for semen to pass through during ejaculation.
Exactly.
That's fascinating how the body takes both functions into account.
It is.
Okay, so let's switch gears now and talk about the female external genitalia, the vulva. We touched on this briefly before, but can you remind me, what are all the structures that we're talking about here?
Yeah, so the vulva includes the mons pubis, the labia majora, the labia minora, the clitoris, the vestibule, the bulbs of the vestibule, and the vestibular glands.
Okay, starting with the mons pubis.
All right, so the mons pubis is the rounded, fatty area that's over the pubic symphysis. And after puberty, it's covered with pubic hair.
Right. And then we have the labia majora.
Yes. The labia majora are the 2 prominent folds of skin that extend downward from the mons pubis.
Okay.
And they're also covered with pubic hair after puberty.
And then nestled within those are the labia minora.
Exactly. Yeah, the labia minora are 2 smaller folds of skin, and they lie within the labia majora.
Okay, and they enclose the vestibule.
They do.
Now, the clitoris, remind me about its structure and function.
Okay, so the clitoris is a small erectile organ that's located at the anterior junction of the labia minora.
Okay.
It develops from the same embryonic tissue as the penis in males.
Okay.
And it's very sensitive to touch.
So it's essentially the female equivalent of the penis.
You could think of it that way, yeah, but unlike the penis, it doesn't have a urinary function.
Right. Okay. Good point. And the vestibule, what was that again?
So the vestibule is that space that's enclosed by the labia minora, and it contains the openings of the urethra and the vagina and the ducts of the vestibular glands.
Okay. And the bulbs of the vestibule.
So the bulbs of the vestibule are masses of erectile tissue that lie beneath the labia minora, and they become engorged with blood during sexual arousal.
Okay.
So they contribute to the overall swelling and sensitivity of the vulva.
Okay. And finally, the vestibular glands.
Right. So the vestibular glands are responsible for producing mucus that lubricates the vagina during sexual arousal.
The lubrication team.
Yeah. And there are 2 types: the greater vestibular glands, also called Bartholin's glands, and the lesser vestibular glands.
Okay, what's the difference?
So the greater vestibular glands are larger, and they're located on either side of the vaginal opening, and the lesser vestibular glands are smaller, and they're scattered throughout the vestibule.
Okay, it's amazing how all of these structures work together.
It's a beautiful testament to the design of the human body.
Well, I think we've reached the end of our deep dive into the pelvis.
We have.
It's been quite a journey going from the bones to the muscles to the reproductive organs.
It has been a pleasure.
And to our listener, we hope you enjoyed this exploration as well, and we encourage you to continue learning about your body and to appreciate all the amazing things that it does for you every day.
I second that.
Thanks for joining us on The Deep Dive.